ask the questions and then you can respond to them. What do you think, what has happened with your healthcare prior to this project?
Personally, it was a dead loss, because I found the doctors, I don't think it was the doctor's fault. I think it was, there's just too many people, and they don't give you time, and they're only interested in giving you medication and getting rid of you.
Whereabouts was this?
At Southend.
Okay.
And I stopped going for that reason, because I don't take tablets. And to be told that you've got arthritis without x-rays, because I had a back problem, without x-rays, you've got arthritis and all you've got to do is live on medication, painkillers, is not an answer for me.
You've been in this project for how long, the community-oriented primary care?
Since March, I think.
So how have you been?
Since April.
So how have you found this project?
I found it far better, because you make your appointment, you come, you get seen to. Dr. Meister spends time with you. She's not prepared to just make a snap decision and then give you a lot of medication to walk out the door with. And that's what I like.
Okay. What do you think we could do better?
Get Losa here and to save me from going to Southend.
You're ready?
Hi, my name's Alex Meister. I'm a community service doctor. I'm working in family medicine in the Joburg Metro. I was allocated to the COPC project from January this year. I've been working in it until now, which is September. I started working in Southend Hospital, and now we've reallocated to Rosettenville. I also work in the clinics as well, on the old system of just seeing queues of patients, and then now the COPC is more on an appointment basis, where we have community care workers working with us who are involved in the community and have a role in helping patients with health education. My experience of the project is that it's been very positive from the point of view of patient experience. I feel that they feel they're better looked after, and they are receiving better care because they get followed up by the same healthcare worker. So whether it's the sister or the doctor, but they feel that they've got a better relationship with that person. Then I also think it's great in terms of the community care worker, because I feel like it's our hands out there in the community, and we can have a greater reach in terms of health advice, education, reaching patients who have defaulted or patients who are struggling to get to the clinic. And I think that has a greater role in also helping patient satisfaction, because they feel that they're being helped in more than one way. I feel that for me it's also been very rewarding, because I feel I have a better relationship with patients. I think with having a relationship where you get to see the same person following up, and the patient isn't lost to seeing another doctor or another sister, you get to follow up on their problems. You remember, for example, if you changed something, why you changed it. You remember when they're due for blood tests. So I think especially for chronic problems, it's better care in terms of follow-up, and in terms of following up blood results and being able to give them better care. And then also in finding out other problems. For example, if someone comes repeatedly for problems, you can maybe think of what their circumstances are which are making these problems happen, or how it affects the family, because this gives us the luxury of seeing a whole family together. You can see the impact of the family on the patient and vice versa. And I think dealing with those problems can make bigger differences in health than just prescribing medicines for a gastro. To try, for example, improve hand washing in a household will make a bigger difference in the long term. So I felt it's quite rewarding from that point of view as well.